Hey, if your doctor has put you on metoprolol, whether it was for your blood pressure, your heart rate, heart palpitations, anxiety, migraines, or an irregular heartbeat, and you feel like you don't fully understand what this drug is doing inside your body, what your options are, or anything about this drug, you need to watch this video because understanding your medication is the first step to having a real conversation with your doctor about your health. You see, metoprolol is prescribed over 80 million times per year in the United States. 80 million. It's one of the most commonly prescribed medications in the country. And yet, most people taking it have never had a full conversation about how it works. What are the known side effects? What are the complementary approaches that could support their heart health alongside their treatment plan? That's not okay. You deserve to understand what's happening in your own body. And as a healthcare professional, that's what I'm here to help you do. My name is Joel. I'm a registered nurse and a naturopath. And I've spent 20 years in the ICU, the ER, and in critical care, and I've administered Metoprolol IV in many emergency situations. I understand this drug at a clinical level, and I believe in your right to be informed and educated. This is not medical advice, this is health education. So always work with your healthcare provider on any changes to your treatment. But let me explain what metoprolol actually does. So it's a beta blocker. That means it sits on the receptors in your heart, the receptors that adrenaline binds to when your body needs your heart to speed up, like you're running from a tiger or a lion or a bear, and it needs your heart to pump harder. Metoprolol blocks those receptors, so your heart can't speed up. Your heart can't pump harder. That's how it brings your heart rate and your blood pressure down. So if you're on it for blood pressure, it's reducing your cardiac output. So it's reducing the amount of blood that comes out with each pump. If you're on it for anxiety, it's blocking the physical symptoms like racing heart and trembling. But here's what's important to understand. It's addressing the physical response to anxiety, but not the anxiety itself. And if you watch any of my videos, you know I'm very, very keen on teaching people how to find the cause, because the cause is the source of the effect. And if you're just trying to treat the effect, it's like trying to mop a flooded basement with the leak still running. You just can't feel your heart racing anymore with metoprolol, but it still hasn't fixed your anxiety. If you're on it for migraines, it's reducing the blood vessel dilation in your brain. So if you're on it for arrhythmias, it's suppressing the electrical current in your heart. These are legitimate medical uses, but regardless of why you're on it, the side effect profile is really the big piece. These are published side effects of metoprolol. So listen, fatigue, up to 26% of beta blocker users, according to the Journal of American Heart Association, that's 1 in 4 people experience significant tiredness. Now, I don't know about you, but I don't need any extra tiredness in my life. Weight changes, 12% decrease in your metabolic rate from metoprolol. So that means you're exercising 12% more to get the same amount of weight off, if that's a concern of yours. Mood changes. Metoprolol goes into your brain, like it crosses the blood-brain barrier. And so they've seen a connection between beta blocker use and depressive symptoms. So if your mood shifted when you started your metoprolol, that's part of it. Insomnia. Beta blockers have been shown to reduce melatonin production, which is the sleepy hormone, by up to 80%. So that's insane. Circulation is another common side effect. Decreased circulation, cold hands, cold feet, because metoprolol reduces the blood flow to your hands and your feet. And then for women with perimenopause, your hormones are already shifting. These side effects overlap and amplify when you're in a perimenopausal season. So that's a lot to handle with a drug that, honestly and frankly, like, it's important if you have some of these more serious issues, but some of the things like anxiety, it's shown that it is not any different than a placebo pill. And a placebo is just an empty capsule. I talk about that in my next couple parts of this series, so stay tuned for that. But these are complementary herbal supplements that you can take that will help you replace metoprolol over time. Number one is magnesium. Magnesium is involved in over 300 enzyme reactions in your body, including the smooth muscle relaxation and the electrical current in your heart and nervous system. So 80% of Americans don't get enough magnesium. So if you're experiencing muscle cramps, trouble sleeping, anxiety, elevated blood pressure, you need to have a conversation with your doctor about your magnesium levels, specifically the RBC magnesium test, not just the standard serum test. That one doesn't necessarily show magnesium depletion. So magnesium is number one. Number two is breath work, learning to breathe better. When you're anxious, when you have high stress, you'll notice that you breathe very shallowly. And that decrease in oxygen causes your vessels to constrict. So box breathing, which is breathe in 4 seconds, hold 4 seconds, breathe out 4 seconds, hold 4 seconds. And that box breathing, military actually do that during active combat to get their brain focused, to calm their nerves under live fire. So it's very, very effective. And then number three is passion flower. For those of you that are on metoprolol specifically for anxiety or stress-related palpitations, passion flower is one of the most studied natural calming herbs. A clinical trial published in the Journal of Clinical Pharmacy and Therapeutics found that it performed comparably to commonly prescribed anti-anxiety medications for generalized anxiety, with far fewer side effects. Unlike a beta blocker that blocks your heart's response to stress, passion flower supports the calming of the stress response itself. This is something worth researching and bringing to your doctor's attention. Now listen, I need to say this very clearly. Never stop or change your metoprolol dose without your doctor's supervision. Beta blockers must be tapered gradually. Stopping abruptly can cause serious complications, including rebound heart rate spikes and blood pressure surges. So, if you are interested in exploring complementary approaches, have that conversation with your provider. Bring them the research, be your own advocate, but do it safely together. So I promote people to use these herbal remedies while they're continuing on their medication, and slowly the numbers will speak for themselves as you report them to your doctor. But I've put together a 10-day heart health challenge where I break down the research on natural approaches to heart wellness. If you want access to my 10-day challenge, comment the word HeartStrong in the comments, and I'll make sure you get the details. In part 2, I go deeper into an herb that clinical trials have shown supports heart function, and I break down the research on why it's been used in European medicine for over 2,000 years. My name is Joel. Be your own doctor.